Are you confused about the difference between Botox and dermal fillers? You're not alone. These two are often talked about together, but they do completely different things. My name's Dr Nikita Desai. I'm one of the facial aesthetic doctors here at Harley Street Skin Clinic. I specialise in non-surgical aesthetic treatments, and I am available here on a Monday and a Tuesday. Botox is a neuromodulator. It helps change the way or relax muscles in the face. So if somebody is struggling with fine lines which are being caused by movements of expression, it's a great way to soften those lines and help hold the skin a little bit tighter. Fillers are volumizers, so they are useful in areas where patients have either lost volume or are looking to increase volume. For example, the lips. They have a different type of injection technique and they hold different risks to Botox. As previously mentioned, Botox is a neuromodulator. The effects of it are temporary. The normal duration for Botox treatments on average are about 3 to 4 months. After that, the muscle returns to its original activity and those lines continue to form. Fillers can range from anywhere between 6 months till 12 to 18 months, depending on the thickness of the filler used. There are different types of dermal fillers available on the market. The key difference between dermal fillers is the thickness of the filler, the G' of filler, and where we're looking to place the filler. If you're looking to place the filler in a deeper layer of the face, so closer to the bone, for example, we want something with a little bit more support, which is going to help support the tissues. If you're looking at placing dermal filler closer to the surface of the skin, we need something that's going to be a little bit lighter to help maintain a natural result. Another key difference between Botox and dermal filler is time of onset. So for Botox, it can take up to 2 weeks for a patient to see their full results. And for dermal filler, often that patient leaves the room seeing majority of their results. A good way to know whether you want to have a Botox or a filler treatment is first of all to consult with a doctor. But typically, Botox is used to relax fine lines that are created by muscle movement. So if you're somebody who typically frowns when they're speaking, or you happen to be a very smiley person who gets lines around the eyes when they're smiling, Botox is a great treatment to help soften some of those lines. You would use dermal filler if you were looking to replace volume loss, which is something that happens during the aging process, or if you were looking at further enhancement. So somebody who wanted, let's say, more sculpted cheeks, wanted a slightly fuller lip, or even those patients who need what we call profile balancing. So there are a group of patients who, let's say, genetically have a slightly smaller or further set back chin. In order to bring balance and harmony to their face, we can place dermal filler into these areas to help balance the proportions of their face. Botox and filler can be used in one sitting for a full facial rejuvenation, but it's important that we understand the key differences between them and then the areas that they're typically placed. Botox is commonly used to freshen the upper part of the face, so the area around the forehead, the frown and the eyes. It can be used to help open up the eyes, potentially lift the brows and open up the eye area, which leads to a fresher looking appearance. Filler can be used to help rejuvenate the areas where volume has been lost in the face. So for example, the cheeks or the mid face is typically an area where we first start to lose support and volume. So it's a great place to start when looking at a patient and assessing their mid face to see if they need a little bit more volume in that area. If you're somebody who's interested in talking through what Botox or dermal fillers can do for you, then feel free to contact our clinic and book in a consultation to start your journey with us.